Bismillahirrahmanirrahim. Assalamu alaikum. My name is Fiza Ahmed. I am student of BTS first year. So today my topic is the glossopharyngeal nerve, which is the cranial nerve number 9. This is the mixed nerve, motor as well as the sensory, and there are three nucleus of the glossopharyngeal nerve in the medulla oblongata. The first is the motor nucleus, which is the inferior salivatory nucleus. The second is the parasympathetic nucleus, which is the nucleus ambiguous, and the third is the sensory nucleus, which is the nucleus of the tractus solitarius. First, I will tell you about the course of the glossopharyngeal nerve. This nerve arises from the anterior margin of the medulla oblongata and leave the medulla oblongata by passing between the inferior olivary nucleus and the inferior cerebellar peduncle. After passing out through the medulla oblongata, it leaves the skull through this jugular foramen, and after leaving the skull, it descends downward through the neck and give different branches, which are the tympanic nerve to the parotid gland, the nerve to stylopharyngeus, the pharyngeal branch, and the lingual nerve, and the last is the carotid sinus branch. So this is the complete simple pathway of the glossopharyngeal nerve. Now I will tell you about the nucleus of the glossopharyngeal nerve and their innervations. The first one is the motor nucleus, which is the inferior salivatory nucleus, whose fiber is responsible for the innervation of the stylopharyngeus muscle. The second one is the parasympathetic nucleus, which is the nucleus ambiguous, and the fiber of the nucleus ambiguous is responsible for the parasympathetic innervation of the parotid gland through the tympanic branch of the glossopharyngeal nerve. And the third one is the sensory nucleus, which is the nucleus of the tractus solitarius. The sensory nucleus of tractus solitarius receive efferent information of the taste, sensation, and the common body sensation, and enter the brainstem through the glossopharyngeal nerve by passing through the superior ganglion of this nerve, but these sensation terminate at the spinal nucleus of the trigeminal nerve. The carotid sinus, which is the baroreceptor, located at the bifurcation of the common carotid artery, the efferent impulses from this sinus also travel with the glossopharyngeal nerve, and these impulses terminate at the nucleus of tractus solitarius, and this nucleus is connected with the dorsal nucleus of the vagus nerve, and the carotid sinus reflex, which involve the vagus nerve and the glossopharyngeal nerve, assist in the regulation of the arterial blood pressure. So here we are end with our the glossopharyngeal nerve course and its important nucleus. Thank you.